Well, this is Jane Glade. Welcome to the Empowered by Victors podcast. I know you and I get to spend a lot of time together and communicate quite a bit, but it's fun to see you in this platform
Thank you.
in an educational perspective, and also I feel like probably fairly entertaining perspective. So thank you for taking your time and being here with us today. I'm really excited to dive into conversations around women's health with you.
Yes, absolutely. Me too. Thanks for having me.
Yes, absolutely. Well, let's just dive into get an idea of your background, just so that people have an idea of who you are, what you do in this world. What drew you to healthcare in the first place for a career path?
Well, I initially started out in engineering. So I actually didn't even go into college thinking I would do anything in the healthcare career. I saw my mom grow up as a nurse, and when I was young, she was working hard hours every weekend. And I was like, I am never touching a bedpan in my life. Like, don't even ask me to do it. It's not going to happen. And then when I was in college, I was at the dorms at UNL, and I was talking to one of my roommates, and she was just telling me all the things that she was doing as a CNA up at Children's, working with these little neonates. And I was like, wow, that's amazing. Like, I want to do that. And the next day, I changed all of my classes, changed my major, showed up at my mom's door and said, Mom, I'm going to be a nurse. And she just started crying. She's like, I knew it. I knew it all along. It was going to happen. And then when I was working on my RN, I knew that I was going to go back and get my master's in nurse practitioner, even though at that time we didn't even really know a lot about it, what a nurse practitioner did or what their role was. People had never heard of the title, but I still knew that I wasn't done. I worked in the ICU, and I saw so many people come in that had chronic conditions and things that were so preventable. I was like, gosh, if somebody had just talked to them at a younger age, educated them, given them the tools to make these better life decisions, or just given them some knowledge about some of the things that were happening, maybe they wouldn't have been in that position. And so then I went back to Creighton, and I got my master's, and then I practiced for quite a few years, and then decided to go back and get my doctorate. In 2016, I started that at Creighton University, where I'd gotten all my previous degrees. And I thought, I just need to go back, learn more about the healthcare system, how to make bigger change, and then so ended up doing my doctoral program, finished that in 2019. So I got my master's in 2007, and that's when I started practicing as a nurse practitioner. I'm family nurse practitioner certified, and I've been treating all stages of life since 2007. So yeah, 17 years now.
That's awesome. That's awesome.
Yeah.
So when did the breast cancer side of your work start for you?
Yes. So I came out of rural and started working women's health in 2010. And at that point, I, was doing lots of annuals, lots of education, a little bit of a younger population just when I started out, because I was a little bit younger at that time compared to the colleagues that I worked with at that clinic. But then in 2015, I ended up at a women's health clinic, an OBGYN clinic. And so then I started a program there talking about just risk assessment, looking at family histories, personal risk factors, and then developed a program to identify women at high risk for cancers. And then those who had breast cancer, kind of help supporting them through a new life journey after diagnosis. And after 5 years, that took me to start up a clinic at one of the institutions in Lincoln, and started looking at, supporting newly diagnosed women and then just high risk women. So making sure we knew how their lifestyle should be. And that's really what ended up taking me into Bring Wellity to Lincoln. And I saw so many women who would come to me because they were high risk and their family members had breast cancer, or they'd had a biopsy, they had dense tissue. And I'm like, gosh, we're really missing the boat on some of these lifestyle changes and education that can really reduce the risk. So I saw so many needs in my patients that I really didn't feel like I could fulfill for them in that role. And so I took the leap, and I opened Wellity in 23 March. So we've been open up a little bit over a year at this point. And we do, all women's health, education, high risk survivorship. We do cancer survivorship, navigating that new realm, and just really want them to feel women. I do see some men now, but primarily women that can come to a place they feel their needs are being met, they're heard, they can advocate for themselves, and just really get a lot of the education and tools that they need to feel good, right? I mean, that's the idea, is like, we want to feel good. We want to have a healthy life, live longevity, live a long time, be there for whatever it may be years down the road. And so that's kind of what fuels me and makes me do what I do every day. And I enjoy it.
Yeah. So obviously you don't just work with survivorship and high risk patients. Now you're seeing, essentially all stages of life.
Yes.
Right.
Mm-hmm.
Okay. So then with that being said, what is let's say, I don't know how many, I think that this could be an entire episode, which is a different conversation, but how many women that come to me and they're like, I have this concern, but my doctor is saying that's not a big deal. Or, my OB is saying that, it's common and it's normal or whatever it may be. I just don't feel great, or this feels off, or I don't know, something's off, but they're being told, essentially like, you're fine. Or this is normal. And, women are getting frustrated with that narrative consistently. And so they're seeking like somebody that's going to listen to them, and somebody that's going to believe them. And somebody that maybe is willing to get in the trenches with them and figure it out, even if it isn't just like a quick fix or, something simple in those regards. So let's talk a little bit just about your approach and your treatment plans with, let's just say an average woman that's walking in with low energy, maybe has some weight gains that they've experienced recently, and just overall just like looking to be heard.
Mm-hmm. Yeah. So, that's one of I just love when women come in and we can have conversations about whatever it may be, whatever their concerns are. And for me, it's really about getting to know the patient on that first visit. We do the basic things that are pretty standard. We have them fill out their health histories or questionnaires, family history, cancer risk assessment, all those things. But that first visit is really like, I need to get to know them. Like, I need to know like what's going on in their life. I get to know their personal history, their gynecological history, their obstetrical history. So lives with having children or losses, those types of things. That's super important to me. Their menstrual cycles, their menstrual history can clue me into a lot of things that we might be missing or that we need to do an investigation on. We've trialed it a couple different ways where we're like, well, maybe we do some labs first and then you meet with them because of the demand. But I missed out so much on just the very few people I tried that on because I didn't know them. I was like, we can do all the labs in the world, but until I know you, your life, what you're looking to find and what I can do, then I'm lost. So bringing them in and having the conversation about, what are your health goals? Like, what are your wellness goals? Like, what do you see for yourself in the next year? If I can wave that magic wand, what would it be that you would like to see happen? And I'm like, I don't know that there's always the perfect answer or puzzle piece that I can fit in that initial like treatment visit, but really trying to like put some pieces together. And I usually do tell them it's not going to be magic from the get-go. I like, these are things that we need to work on and tweak. And so we usually do a full panel of labs, on most of my women to look at inflammatory patterns, their heart disease risk, their metabolic health. So we're looking at insulin, average blood sugars, liver function testing, kidney function testing, blood counts, ferritin, B12, nutrients, vitamin D. And then for those appropriate that we want to have the conversation, we'll look at their hormone levels. That just depends on where they're at and what they want to look at and things like that. But that can give me a piece of the puzzle to what's going on, how they're feeling, why this may be associated with this. And so we usually start with that, and we'll start with cancer genetics, if that's a cue, because that helps guide me how aggressive I need to be with their metabolic health or their weight management, or hormone, evaluation, cancer screenings, whether it's, looking at the ovaries differently, looking at your breast tissue differently. I feel much safer and more well-rounded in taking care of patients if I understand what their various risks are in regards to family history, cancer risk, metabolic health, and all that. So first visit is really a lot of get to know each other, and we talk, and I'll do an evaluation examination. And then we usually proceed with some lab work with a follow-up visit, and then start building that treatment plan.
Yeah. Yeah. I mean, and I've experienced that. And I know a lot of other women that have seen you that have experienced the same thing. One thing with the labs I think is interesting. Every doctor or, provider, interprets labs so uniquely, right? Like what they consider to be normal or what they are concerned about or whatever it may be. Like I think in my experience of the care that I've gotten over the years, like everybody's worried about something different or like a different level that maybe they're more concerned about.
Mm-hmm.
So what are like the big markers with women? I know you kind of mentioned a few there, but maybe that you interpret a little bit different than some other providers might.
So it somewhat depends on their life stage, what I'm looking at, because we're trying to optimize. And I use the words a lot of like optimal versus normal, a normal ferritin versus an optimal ferritin is quite different. Same for thyroid levels. So I really look at everything for every patient, and I get that a lot. Like, well, that was a really thorough lab review. And I was like, well, yeah, you're not going to, and that's one reason why I bring people back, because some people are used to like a phone call. And I'm like, no, we really need to sit down. You need to understand like what these levels mean and where you're at for us to get a good picture of like what we need to focus on. So thyroid levels are huge for women, cortisol, and, all of your metabolic factors. So I do some additional labs like a high sensitivity CRP, which is an inflammatory marker. So I can give you a really good idea on like where we're at with the metabolic health portion of it. Vitamin D is huge. We just don't know enough about vitamin D for women, I think, and it's huge for bone health. Almost everybody in Nebraska is deficient. So we really need to focus on looking at that. And that's a lab value that a lot of insurances won't cover. So that can be a hindrance where some providers aren't able to draw it because they don't, they can't, it's an impairment for them because they just really don't have a way around that. And then hormone levels can be very indicative of various things. Hemoglobin A1C, I do a fasting insulin on women. Your complete blood count can clue me into a lot of things, immune system wise, what's going on, various energy levels, your menstrual cycles, what's happening with those, B12, very different levels. And I look at it all, I'm like, I wish I could pick, like, if I could do like 5, these are the great ones, and I probably could on a follow-up visit. I think a high sensitivity CRP is one that can be very insightful for women. If we're looking at like cholesterol, there's a couple of different lab values that I often run on my women who have an elevated LDL, which are more specific markers that I know women aren't getting done, like an ApoB and LP(a), which you wouldn't know at all what those mean. But just knowing that we can ask for these things. Don't just tell me I need to take a atorvastatin, a Lipitor, a statin medicine because my LDL is high. Let's dive in to say, really, truly, are you going to benefit? Do you need these medications? Are there other avenues we can take before just putting out a pill?
Yeah. So really you're taking like a ground up approach, right? Like
Yes.
we're figuring out like the root cause or maybe not cause or
Yes.
maybe a root prevention of
Yes, exactly.
Where this trajectory could lead us based on where we're at right now and where, you're telling me that you want to go. And I think that is a little bit unique in regards to being proactive versus reactive, I think, within medicine, and lifestyle changes and everything else. It is a little bit unique in that way. And I think a lot of women and just people in general are looking for that now. Like we're starting to wake up a little bit more, at least in that regard of like, oh, like I want to prevent this from being an issue in the first place versus like all of a sudden waking up and now, I'm in the hospital for XYZ, 20 years from now. What could I have done different, earlier on?
Absolutely. Yeah. I think prevention is the key. And that's one of the things that took me into genetics really hardcore is because one of the biggest cancers, ovarian cancer, is we have no prevention. We have no detection for it. We have no early screening. So or early detection, I should say. So understanding where your risk factors are, and if you're truly a high risk, like being proactive and being preventative about that. But now, we do know like down the road, dementia for women it's a huge concern. We want to keep our minds and our bodies healthy. And these are, the early ages are the ages to start being aggressive with it or talking about it or understanding if there is a familial versus a lifestyle risk that we need to mitigate and kind of address. So yes, prevention is key for me. I've always talked about it. And that's, I think, one of the unique things about nurse practitioners some of the time too, is that we love education. We're very much educated and trained on prevention. And so that's where a lot of my heart lies. And so I try to incorporate that in every conversation we have about what we can do. And, just what you guys do at Victor's too, it's so much in that sense about prevention with how you're educating, because bone health is another big passion of mine, osteoporosis. And, we have to be impactful at these young ages with that, because a lot of women don't get calcium in their diet anymore. We have dairy intolerances, dairy sensitivities. People think that that's a bad thing that they should be taking in based on whatever they've heard. And so we're really getting to the point where we're not getting our young ladies calcium as they should, and vitamin D. Incorporating the importance of strength training is something that's so important in the preventative side.
Yeah, I'm toot my own horn there, but yeah, I agree entirely on that. Absolutely. From a preventative, standpoint, how did we get here? Like, how did we end up here? I was listening to a podcast a couple of days ago, and they were talking about, the way that our world looked back then, as far as, maybe some more muscle mass on the human bodies, less body fat on the human bodies, just on average across the board. 30, 40 years ago, like, we as humans probably looked a lot different. And then in regards to women's health, like, I think that those same issues still were there at that time. It's just now, I think I was joking the other day, like, millennials, I think, are the chatterboxes of like, we want to implement changes and we're not quiet about it. So we're like starting to chat like, hey, like, this is what we've experienced, as we're starting our period. This is what we've experienced through childbirth and all of these things. And now, like, entering perimenopause and menopause, like, hey, like, yo, like, something is happening. Yes. Something's happening right now. So what do you feel like are the biggest factors that are leading women into these, like, almost like uphill battles in regards to their overall health and just everything?
I think about that all the time. I just wonder, because I see a lot of women who are living fairly healthy lifestyles. I mean, they're not overeating, but I think the demands on life, which are things that I even tell my patients, we can't get rid of those things. I mean, you can't stop being a mom if that's the path for you. You can't stop your job. I mean, there are so many things that we do have somewhat of a control over, but so many things that, in a sense, we don't have that big of a control over. I think nutrition is one of the biggest keys. I do like, how our world has changed in regards to the accessibility of various foods and the quickness, the ease that we need to be trying to fuel our body and our kids' bodies. I think sleep is a big one. I mean, I will tell every patient, like, sleep is a pillar of health. Like, if I can fix anything, let's work on that, because that affects your blood sugars, that affects all of your organs, so many things. I think a lot of women probably have sleep apnea that are unrecognized, which can affect so many different things. I don't know that there's one thing, and I would love it, if we could be like, that'd be the perfect mix to be, done and over with and figure it out. But I've had many colleagues that we've talked about where we're seeing perimenopause women, and I'm fatigued, I'm starting to get midsection weight gain, and their blood pressure might start to creep up, but they're not necessarily obese or overweight in their BMI. But they're trying so hard to do the right things and they're not seeing changes. Well, we know it probably goes back to their hormonal system, and so many things we put into our body and put on our body can disrupt this lovely, supposed to be smooth flow of these nice little hormones that are not even just hormones like estrogen and progesterone or sex hormones, but cortisol, everything that way, serotonin, neurochemicals in our brain, all affected by a lot of different things. And nutrition and gut health is one of the biggest keys for that too. So how we're feeling our body, how we're treating our body, sleeping, moving our body, I think we've gotten more sedentary, we just aren't as active. We're a lot of desk jobs, a lot of working from home still. I think from COVID has had a huge impact on women, isolation that way. There's so many different factors, but I think where I try to just educate is like, let's work on sleep, let's work on nutrition and moving your body. Some of the 3 pillars that we do have some control over a lot of the time. So we can start there. We can usually find some improvement and then kind of work on some of the other things too.
Yeah. And I think that we have some also like pretty big, large, unrealistic expectations on ourselves day to day. From the tasks that we're taking on, the capacity that the human body has to handle all the different stressors and all the different demands that we are putting on ourselves. We all have choices, but like you said, like being moms, and do we have to sign our kids up for all the things? Probably not, but what winning those battles is sometimes not worth it either. So I think it's an all-encompassing thing, and I think the nutrition side of it is a huge component, absolutely. But like the food quality in our world has changed so drastically. Accessibility, I mean, I'm appreciative of the convenience of food the way it is now because of how busy we can get, but it's also what are we sacrificing in the meantime, from a longevity perspective and an overall energy perspective, to execute life well. Like you said, like it has to be an all-encompassing approach, right?
Yeah. And it's hard. It's such a double-edged sword because we all know these things, right? We know like eat well, sleep well, exercise. And those are the things we need to do. Sometimes that's not enough, unfortunately, because of our bodies being a little against our own bodies, and so I think then that's where the key factors of finding those little things that we can tweak and make better definitely can improve things too. And then once we start to see the things that we're changing, that we maybe just are tweaking just a little bit, getting a little bit better habit in certain things, going to bed 30 minutes earlier, or not working up until the time that we're trying to shut our eyes. Those things can eventually roll into really good habits that eventually trickle down. But a lot of other ways that we can help too. I just feel bad saying like, you need to do these things and you'll be better, because that's not the reality most of the time.
Not that easy. Yep. So, I mean, we're going to do like a little like hot topic, I think you and I, over a few series of conversations, because I get asked so many times about, I am a fitness professional. That is my realm. I know enough in nutrition to be dangerous. But I definitely feel like, strength training and the mental coaching of lifestyle changes is definitely kind of where I fall. But I get so many questions about, hormones and, how are my hormones affecting this, or how is, what's the best route for navigating perimenopause or menopause, or what's a normal cycle, or, just like, endometriosis, PCOS, like just constant questions and women wanting help and wanting resources. So I think that will continue to be a conversation that you and I have. But I want to ask before we get into a hot topic here, do you feel like for the most part, I mean, I'm generalizing a little bit here, that really inflammation at its root is a big issue within women's health? And specifically, like, I think one of the hot topics out there right now is like estrogen dominance, or, hearing about like estrogen dominance being a thing that women need to be aware of. I guess in my mind, that kind of plays into inflammation quite a bit, but maybe just speak to that really briefly.
Yeah, I mean, it's a true thing, and there's so many factors that go into it. It's not our body's making too much estrogen. It's not, taking too much estrogen. The thing with perimenopause, and it can happen at a very young age, And there can be transition periods. It's not like you're in it forever, you know. Hormones are very intricate. And I hear this, you know, from various time to time, like, well, you did this for so and so, or, you know, or I hear them talking and they're like, well, she did, you know, she recommended this. I'm like, it is different for every single person.
Every body is
Yes,
different.
if you have somebody who's going to a provider and they're prescribing the exact same thing for you to the next person, it's not right, you know, because it is so very different from person to person. But yes, estrogen dominance can be a real thing. And I think one of the things that we're kind of missing is what we're putting on and in our system. You know, I mean, the food we eat, the things we put on our body, the lotions we use, the scents, all those things can disrupt our whole endocrine system, and lead to like these fake estrogens that are going on. And then we're like trying to, you know, make good estrogen in our system. Well, which pathway is that estrogen going on? How are we metabolizing it? All those things can play into it. And you can have estrogen dominance whether you're obese or whether you're, you know, very thin. You know, it's just a lot of how you are metabolizing it. It's a real thing. You can sometimes diagnose it based on symptoms, and do very little small therapies that may be beneficial. I think it's a deeper dive than that most of the time, close follow up, because that's how we see what's working and what's getting better for you. But perimenopause is something that we really need to address better. And the one thing I say with that is just don't rest until you get your questions answered. You know, just find somebody, you know, research how you can, good sources, but find people that will answer your questions. And it's not well, that's your new normal. You know, like, I'm sorry you're so tired all the time. Like, it's just sleep more, drink more water, you know, whatever it may be. You need to exercise more. That's why you're so tired. Just find people who can, you know, really answer your questions, give you some information that's sound, that you feel good about, and start seeing some improvement.
Yeah, absolutely. Well, and I don't know how many people I know in the local world, but obviously anybody else not around here know this, but I do a little bit of consulting with you within your practice, specifically on your metabolic reset program, being a step in their journey of just like sitting down and talking about what does movement look like in their life. How are we hopefully prioritizing strength training in some way? You know, that a lot of women have a lot of intimidation, understandably, around strength training, especially on their own, especially, you know, just walking into a gym and really not knowing what to do or how to do it. You know, we can say go strength train until we're blue in the face, but that doesn't necessarily always mean something to everybody. So I do a lot of that with your patients there. And a lot of those patients are on the hot topic of like GLP-1s, right?
Yeah.
And I'm not gonna lie, when I first heard about, you know, before I started working with you, and, you know, before I've become more educated on the topic, when I first heard about these medications coming out, I had some I think maybe some personal reactions, but also just some, you know, informed enough to feel a little uncomfortable about this type of resource, right? We've come so far in regards to getting women to focus on their strength and focus on their body positivity as much as possible, and like all of these things within the fitness space and hopefully just overall. But also, you know, a big part of what I do with clients a lot is like advocating for themselves with people like you. Like, am I represented in the research of these recommendations? Am I represented in you know, the potential risk factors or benefits or any of those things? Because women have been underrepresented within a lot of research out there. So, you know, when these medications started coming out, that was like my first thought was like, okay, like, but how is this going to affect like us? You know, whether we're wanting to reproduce at some point in our lives, or we're going through perimenopause, or, you know, we're in menopause, or whatever that may be. Like, are women represented in a way that we can feel confident going into this journey? Since then, I have absolutely learned a ton, and I have got off my high horse. I don't think I was public about it, but I definitely had some strong feelings, you know. I never felt like it was a lazy way or, you know, anything like that. I have a lot of people in my life that I love that have struggled with obesity, you know, their whole lives. And having an access to something like this is truly life-changing. And I have always lived in a smaller body. So I, am fortunate in that way in regards to society's perception of me. But it's been really interesting, enlightening, empowering to like work alongside you in that journey and hear your perspectives on these medications and how you're utilizing them responsibly as a provider. Because I think sometimes in the wrong hands that could go, pretty poorly. So maybe just educate us a little bit, start at the beginning here on like hot topic number one. And I'm sure we'll probably have plenty of podcasts on this because I'd love to get Stacy on and like hear her perspective too. But from the GLP-1 in and of itself, like what is this? What is this medication?
Well, so one thing with this is like, I remember, and you ask people around me like that know how I practice, I'm very progressive with medications because I'm not going to use old generics that might help in certain scenarios where we have targeted therapies that truly make a difference. I will go above and beyond and do the prior authorizations and get people the medications in any way I can that they deserve and they need, because that's where science is evolving, right? Like we are getting smarter. Of course, we can't figure out cancer, but we're getting a lot smarter in these metabolic sense and lots of different ways to help people. And so when I started practicing in rural Tecumseh, Nebraska, they brought in the drug Byetta, and it was for diabetes only. It's a GLP-1. And I was like, this is going to change patients drastically. But nobody could get it adopted. Like the insurance wouldn't cover it. I remember having samples in my refrigerator, and I would just like, oh, I'm going to give this to the patient and they're going to do great. And they did. And then nobody would cover it. It was so expensive. It was hard to dose. It was like, dial it up. And I'm talking to a mature population that has other comorbidities, put needles on, get to the right dose, do it twice a day, keep it in there like it was so cumbersome. But I remember thinking like, they lose weight, they feel great, their inflammatory markers go down, their cholesterol improves, their blood pressure. I'm like, these are great drugs. And then it kind of stalled, and I went into the women's health space, and there really wasn't a lot of like presence of it. And then we started hearing like Saxenda came out, which was a daily injection, a still titration up for weight. We'd had Ozempic, Trulicity, Victoza, some early GLPs that were only indicated for diabetes, but you couldn't get those for anybody who were pre-diabetic or, metabolic syndrome patients. And then we came out with Ozempic. All of a sudden people started to get Ozempic, even though they didn't have diabetes. And when Wegovy came out, which is a GLP-1 semaglutide, some people call it semaglutide, whatever. But it came out and I was like, this is great. Once a week. Awesome. In my space, I was in the cancer space then. And I was like, you're going to reduce your risk of breast cancer by 10% if we can lower your BMI, get your midsection down, feel good, get your inflammatory patterns down. And then they came out with their, $25 card for 6 months. And I got all these women on it and they did great. And then they couldn't get the drug. And the same thing happened with Mounjaro, which is a double G, right? To GLP-1, GIP. And I got women on it because we could get it even though they didn't have diabetes and they had other risk factors. And they're amazing drugs. Like there are risks, there are benefits, but they have done things in people's bodies that I have not seen other medications do before. And I don't know that I was ever skeptical when they first started coming out as some people were, because I saw the need for them. Like I saw this women trying so hard, calorie deficits to the point that it was harmful for their body, and still not seeing any movement in their insulin, their A1Cs, their liver function testing, their cholesterol, and how they felt. The society of thinness and skinniness is bad. I don't know that we're going to correct that. But what I look for my women is they've got to, they need to feel good in their skin and be healthy metabolically. Those are a lot of the things that we talk about is energy levels, their sleep, their relationships. And the medication is not a perfect thing, but that's what I want to achieve for them. And so when I find something that helps in a lot of different areas and then rolls into, their mental health is better, I'm like, that's a good thing, I think, with very little risk for certain individuals to take the medications. Now, we don't know how long, women need to be on them. And I think that's a question, but I have that conversation with all of my patients before I ever prescribe anything. It's like, we don't have the super long extended data. I mean, we've had Ozempic for years and years. So we do know that the safety is there. But just like anything, we didn't, blood pressure medications, diabetes medicines, all those things, like, we know they benefited because of the studies, but that the long-term data, and still we know that a lot of them are very safe, but I've never seen drugs do a lot of amazing things for women as these do, and so I've just seen amazing things, and I've seen women not respond to them too, and so then I do take a deeper dive and say, all right, something is going on metabolically, like, we know that there's a big component of genetics for everybody. And there's probably a genetic component of why people do and don't respond to certain medications. And we're looking at diabetes and blood pressure and, heart disease, metabolic risk, and all those things. So that's something that I always keep in mind. And then the muscle mass thing is a big issue for me, because I see it all the time that women are getting these medications from various sources and not educated on the side effects, the risks, the benefits, and how they need to treat their body to be well while taking the medications. Sarcopenia is a big thing where they're just losing so much muscle mass. Their body is not in a good state. And they can start losing hair and feeling very fatigued and depressed. And they're like, but I look better, I think, but you don't feel good, and there's things that you're putting yourself for at risk otherwise. So, I think that was it. Was that an answer to the question?
Yeah, no, it was perfect. Yes, absolutely. Yeah, I think that, it's a personal choice, and the point is to be educated as much as possible when you're making these choices for yourself and working with a provider like yourself that people trust and that they know that, that you have their best interest in heart, and you wouldn't recommend something or think that they would benefit from something, just for the fun of it. Right. Like, but, in my birth training, I kind of went through, an acronym that was given to me, in regards to like making decisions around birth. In that being, you use your brain. You talk about your benefits, you talk about your risks, you talk about your alternatives. I think a big one for women is like, what is our intuition telling us? So I being, what is that intuition, that deep knowing telling us? And then what happens if you do nothing? And obviously in the birth space, that can translate pretty quickly, and things can change and happen pretty quickly where you're having to make decisions on the fly. But in anything, from a health perspective, like what are the benefits of this? What are the risks involved? What are the alternatives? Have we pursued all those alternatives to the capacity that we feel comfortable with? And what's my intuition saying about this? And what would happen if I do nothing? And I think nothing is not really an option anymore for a lot of us women. Like, we're not feeling that way anymore.
Right. Yes.
We want that answer, right? So obviously you spoke on a lot of benefits there, and I would love to like keep diving into more of that. Like, what are you seeing as far as just overall like benefits? Obviously, aesthetically speaking, I know, again, I see you practice, and I know that, people are like, under the BMI of 27, 25, like this might not make sense for, certain individuals that are looking to utilize this medication, because I don't really agree with BMI markers in general, to be honest with you.
Yeah.
But
skinny fat. I mean, that's the thing. Metabolically really unhealthy and be a normal BMI,
right.
And everybody can
really high BMI and be really healthy, right? Like,
yes.
And have a lot of muscle mass on you. But technically speaking, like, I mean, I was considered there for a while when I had my most muscle mass on me. I think I was like borderline, like considered overweight, like moderately overweight, which I was like, I don't feel that way.
Yeah.
So I'm not sure where
and you weren't physically that way. I mean, just a scale and a height number, is how we calculate that.
Right.
So if we look at the benefits, like, I had this conversation with a specialist the other day because they just came out with a new study with Wegovy, and it's now indicated for people who have had a vascular event, a non-diabetic patients, and used to prevent a second event. So they had people who were non-diabetic on blood pressure medicine, on, their cholesterol medicine, and they gave them semaglutide, and they just immediately started to reduce the risk of a second event, like from the get-go, right? And so you could see the placebo arm and the treatment arm just separate crazily. And I said, tell me what the mechanism of action is that's making this happen. And she said, the FDA, the Federal Drug Administration, doesn't know or is not telling us. So, it does a lot of good things in the way it changes our hormones. So we get full faster. It slows down our gut. So we don't feel like we need as many calories or thinking about food as much. But on the downfall that it happens, it's just on the downward where it works in our body, it works in our pancreas and our liver. And so the way it is changing how our liver functions with glucose is so impressive in a way that I don't know that we fully understand it all yet. And that's our liver processes cholesterol, all the things, which is a big thing that we're seeing now in women is fatty liver disease. I don't care what your BMI is. We can see that. And it really puts a lot of stress in our system. And I've seen people completely resolve their fatty liver disease with use of these medications. So I started the Reset program because I was really frustrated with people wanting to get the drugs to be smaller, and I'm like, that's not the purpose of it. Like, yes, that's an end game. That's an end point for some women, and that's a benefit of it a lot of the time. But truly, when we are changing visceral fat and making our bodies smaller, we're reducing systemic inflammation. We're lowering our cholesterol. We're lowering our blood pressure. We are decreasing general inflammation that impairs our ability to sleep well and make good choices and things. And so it's a whole cycle that happens with the medication, which is where I love to see it happen, where people can like, oh my gosh, like you look at how much you've changed in your numbers, but the program is developed to give them the tools of the medication, but also the education portion of it and the additional treatment things that we need to work on. So they're not just treating with a drug that is probably going to do some benefit, but if you don't change and we don't help you to change the lifestyle or little things that are happening in your body or that are occurring on a daily basis, we're not going to see the sustainable greatness that we can see with the medications. And so incorporating a program where you're going to commit to a medication, but you're also getting the tools to have somebody follow you along, see somebody after a couple of weeks, so we know how you're reacting to the medication. Are you tolerating it? What's your nutrition been like? Are you eating enough? Are you prioritizing your protein, your fiber? Now, 4 or 5 weeks in, let's start finding out how to move. And that's where you come in, a crucial part of like, women don't know what to do. They think they're getting the steps in, okay, but they want to lift weights. They want to build their muscle mass and improve their metabolism and prevent the loss that happens with medications. And so you educating them and sitting down and understanding, hormone fluctuations, how the hormones play a part, even in menopause, perimenopause, premenopause, all those things. So it's a it's a team approach, when you're not out there getting some drug at some wherever off the internet or something and thinking it's going to be the miracle drug, and you're all by yourself and you have no idea what's happening or where to go.
Yeah, absolutely. And I know Stassi talks a lot about, her cholesterol changing so drastically, and just like one thing she'll talk about too is like the food noise changing so much. Just her relationship with food and what sounds good starts to shift and change, which for so many of us that like have an emotional attachment to eating, like that is huge. Like those are huge benefits from an inflammation standpoint all the way down to weight loss. Like, just being able to have something that helps you make better choices. And there's also risks involved, right? Like there's risks involved with anything that we're choosing to do. There's risk walking out of our door every day. There's risks involved in all of our health choices. I know like pancreatitis, right, is like one that's kind of been thrown around. I think for me, the big one obviously is that loss of muscle mass. Yes, they're losing up to maybe 20% of their body weight, but that's not just fat. That is also muscle. And especially with women, what we know about progesterone being so catabolic at certain stages of a menstrual cycle, just naturally, the ability for that to kind of attack muscle stores just on your own. When we also have a medication like this at play, like it is a little bit of not a little bit of a risk. I would say it's a pretty big risk involved if we're not doing the things to maintain the muscle mass or even build muscle mass. It is possible. I know Stassi was able to see muscle mass increasing because she was staying consistent with the protein intake and with those things. And I mean, she'll speak to that on her own in a different episode. But it's still like, I think it's a fascinating option, and it's an exciting option. But I also think it's important to realize like these women aren't coming to this decision lightly. This isn't something that they're taking, just like, yeah, I just want the easy route. Like that, really genuinely, that's not what we're seeing. But it is, educating them on that those potential risks are probably a huge part of what you and I both are doing.
Right. Yes, absolutely. Yeah. And I think that's where a lot of the misconception comes with medications is because, people are getting these medications without education. And so then you do risk lots of side effects, and also the failure to take the treatment the right way. I see people just stop but they don't know, it's not usually the ones that I'm prescribing or treating. But yeah, there's so many different things, but yes, pancreatitis is a big one. And I usually feel pretty good about like, for pancreatic cancer people, you have recurrent pancreatitis. It can increase your risk of pancreatic cancer, but also some endocrine like cancers can be higher risk if you're taking these
like
medications.
Cancers,
MEN. But I do genetics on a lot of my people. So I'm like, well, you're not at risk for that. So you can take the medication safely. But if you're not looking at that,
for an endocrine or for thyroid cancer, it's like if you are already at risk, it increases your risk significantly.
Yeah. Correct? If you have a genetic predisposition like an MEN mutation for thyroid cancer, you should not be taking medications. And then there's a question if you have a higher risk for pancreatic cancer, but then you can argue, well, you lose weight, you're going to reduce your risk of pancreatic cancer. So, but those are the conversations I have with my patients. But yeah, I think the muscle mass is a huge one. Obviously, constipation, GI obstruction are huge if you're not treating your gut right, the risks of those things. Problems with your gallbladder. I've seen some women have acute gallbladder attacks. Obviously, we know that's closely associated with pancreas and all those things. So things to watch for. Unexplained abdominal pain is not a thing to mess around with. You need to feel good about calling your provider, saying, hey, this is what's going on. And I think the other risk is that make sure you are getting a medication that is truly an effective, regulated medication. Whether it's a pharmacy, a compound, or an FDA prescribed through the retail pharmacy, you need to know what it is that you're putting into your body. Because you can go online to who knows where and order some research something and inject it. And I have no idea what you're doing. I have no idea what that is, So those are things that as a provider, the risky side, those are the concerns for me with these medications. But yeah, I think, education and guidance and the tools and, I never say, take these drugs, I'll see you in 6 months,
Right.
And I think that, it's like, oh, good luck, and then they come back and they're like, I haven't lost any weight. I'm like, that doesn't happen, for me anyways in the practice. But I think that, we don't know 100% about the dosing either. I think some people really push it and they keep maxing out higher dose. And I don't know that that's the optimal way to do it. Got a friend. He's interested in our conversation. She is, right? She's interested.
She's like, what's that?
I'm going to come out for this. It sounds great. But yeah, so just knowing that you don't have to keep up dosing. I think as we learned, there's probably some resistance to these medications, and so being at the highest dose for years on end, I don't know that that's what everybody needs. And so those are conversations I have too with women about, we probably could use a really little dose and change your inflammatory markers, work on movement, look at your nutrition a little bit closer, tweak a couple areas, and you're going to succeed and feel good. And I saw one this week that I started on the program. And so usually what happens is if we meet, we do labs, we talk about all the different options, change up some supplements if we need to, talk about, lifestyle where it can tweak a few little things here and there, optimize whatever on the labs that we need to optimize. And then they see my nurse who has advanced training, masters in nutrition, and she'll talk to them about like, how's it going with your dosing? How are you feeling? Are you having side effects? Like, are you pooping? Like, what's your nutrition like? Are you eating? And then she'll help guide with my assistance in if we need to increase the dose or not. So I hadn't heard, I knew this patient was doing good because I'd seen her in and out of the office a couple times. And 12 weeks, she stayed on the tiniest dose of the semaglutide and she lost 15 pounds. And she just started tweaking little things and doing the injection, and her cholesterol had dropped significantly. Her inflammatory marker was almost half of what it was. Her liver looked better. And she felt great, and I was like, she was like on a spit of the medicine. I'm like, you're on such a and that's the other thing that I think the stigma is so hindrant to people, to talk about it. I say, if you would you stop taking your thyroid medicine? No, you wouldn't. Would you say I'm taking, yes. Or would you say you're taking thyroid medicine I started thyroid medicine because I had been starting to notice some fatigue and some weight gain? Sure, you would say that, because it's nothing that you are necessarily doing a lot of the time that's making it hard for your body to function well. And these medications can help with that.
Yeah. I think that, we know that, you mentioned bone density and muscle mass and like all of those things being a huge, huge importance for women. And, I think educating them on making sure that if you're going to make this investment in your health, like we need to be making sure that we're investing in like a lot of other things, right? Specifically the strength training component, like it has to be present for the longevity of what you really want. You may become smaller, but you may not feel capable of doing things very quickly down the road if you're losing muscle mass at the rates that you potentially could, especially again, if you're, a hormonally cycling woman and have progesterone working its thing here and there, like it can be very detrimental in that way. So, doing strength training of some capacity being so imperative for all women, but also definitely these women specifically, they just reap the benefits that much more. I mean, it helps with the metabolism. It helps with, just sleep, you name it, it's going to help just right alongside it. It's like these two pieces are coming together and they're able to like elevate to that goal. So yeah, I think that I obviously am passionate about strength training anyway, but within that space, like it is very important that we like do that. And, that they find somebody just like yourself, but within the fitness world that can help them with that. And will it cost a little bit more to hire a personal trainer for a month and teach them how to lift? Probably. But in the long run, like the benefits of that are tenfold once you're educated enough to be able to go in a gym on your own and lift and know what strength training really is for you. And, does the ability to, or the need to have to stay on it, even in small doses, start to come down based on the strength training and the habits that you're starting to create on the other side, and prioritizing protein, right? Like you talk about that, and they tell me that all the time. Mary Jane says I need to make sure I'm eating enough protein.
Exactly. Try to start with your weight.
Yeah.
I'm going to look back on this podcast and be like, all I did was sit there and nod, because we're like on the same page the whole time about how we're educated and taking care of women. I'm like, yeah, that's good stuff.
Yeah. Yes. All right. Well, thank goodness, because otherwise we would not be doing well, but it's good. Like alternatives, right? So we talked about benefits, risks, alternatives, like keep doing what they've been doing. Movement.
I think about that. I'm like, sometimes I sit and I talk with a patient and I'm like, do I even bring it up? Because I know it's going to be really good for them. But the conversation can be a lot because cost is a big thing. And if their insurance doesn't cover it, then what's the next avenue? And, the economy is not the greatest. Things are expensive. Everything is expensive.
Accessibility is hard.
Yes. Oh, yes, exactly. Yeah. And for good medications that are going to work, I wouldn't give anybody anything that I wouldn't put in my own body. But I think that, where was that? We're talking about the benefits. Where was that with that?
Alternatives, sorry.
Oh, alternatives. I look at that. I'm like, gosh, if I can, improve her insulin resistance, is that going to be enough? Well, then are we going to have to add a cholesterol medicine? And where do we need to, are we going to get to the point with the exercise and the nutrition in 3 months that I really am going to see a good change that she's going to be excited about? Because that's important for me, because when you're making changes, you want to reap the benefits, not a scale number. But when I sit down and say, look at what you've done, like your numbers, your inflammatory patterns, your cholesterol, it's so empowering to know that they're doing something that's making some change on this microscopic cellular level. So we have weight loss meds for a long time, but they're not as effective. I mean, they are not. They're more of a systemic, not a targeted hormonal treatment. The same thing for cholesterol. Statins, a great medication. They are, but they're a systemic treatment. And if I can get somebody on a targeted treatment that's treating exactly what I want them to be treating, we see improvements, we see all the benefits. So there's nothing that's truly similar in regards to how it's going to work in the body. So it's definitely a tool. There are different avenues we can start with first. And I think, where do we get GLP-1, like gremlin is in our gut, right? So helping to improve that part of it can be a good step too, where we're maybe we try some things first before we consider adding that or just keeping that into our back pocket, because if our gut is better, a lot of our metabolism will be better. And so it's not always like, I'm giving this to everybody, you need this, because that's not how it is. But there are situations where we're like, this might be a good benefit for you, but let's try different things first and see how you do it. Sometimes they come back and quite a few times they're like, I feel great. I've lost, some weight and my clothes are fitting better and I'm sleeping good and my energy is good. And I started exercising more, started weight training. And I'm like, great, let's keep going,
Yeah. Yeah, it is. The alternatives, and it is infuriating as a fitness professional at times to see clients, especially women. I feel like, I'm going to generalize here, and I'm not saying that men don't struggle with weight loss and gain, because they absolutely do, but it feels like men could take out coffee creamer and lose 10 pounds,
Mm-hmm.
right? They make one little change and it's like a huge significant change.
Mm-hmm.
With women, it just doesn't work like that. It
Mm-hmm.
is not that simple. It is not as simple in theory as the theory of calories in, calories out. It's not as black and white as the, the historically fitness recommendation world of weight loss and health says.
Mm-hmm.
So, these women that are coming in and have, weight loss as a goal, maybe weight loss isn't necessarily the goal, but it's part of the goal, right? It's part of feeling better, and it's part of having higher energy and being able to chase their kids and their grandkids around and,
Mm-hmm.
keep up with life and all the things, enjoy sex, you name it,
Mm-hmm.
all of it,
Yes,
right?
yes.
And it is, the weight loss part of it is a huge component of that. And as a fitness professional, yes, I know 60 to 70% of the changes that their body will make is probably placed on what they're putting in their mouth versus what I'm doing with them from a programming perspective. But even then, we deal with over exercising as almost I would say just as big of an issue as the under exercisers. The women doing too much of something versus, letting the adrenals catch up, or whatever anybody believes on that.
Yeah.
And so seeing these medications come out, it's been amazing. It's been amazing to watch these transformations happen. But I will tell you, even within our gym, I can see it. I can see members kind of looking at each other okay, well, she's got to be on something, because we're all doing the same thing, right?
Same thing.
And all of a sudden she's just losing weight like crazy. And that I would hope that we are a safe space where that initial judgment does get placed and put away. But in the group of women where we're all doing the same things very consistently, it's pretty obvious. Those that are, making lifestyle changes, yes, but the lifestyle changes take longer, right? Like it takes a little bit longer. Or I've had a lot of clients, like members, very excited about changes that they've made just because they've worked on their hormones. They, nothing to do with like any kind of like GLP-1. It's just now they're like addressing their hormone levels, and they're working with somebody that's aware of that and educating them on that, and they see changes significantly. So it's exciting because it's like, oh my gosh, like, and I'm not seeing the strength numbers come down like I thought, potentially early on that I would. If they're consistent and staying consistent and they're fueling appropriately, they're not losing strength like, what you would think on some of these medications. So yeah, it's exciting within the fitness landscape, but it's also like, holding space for women in ways that they can feel comfortable and safe. Like it is not, these medications help in such a drastic way that it is pretty obvious when somebody starts to implement that into their daily life. And, how empowering would it be just to like be supported in that decision and like, hey, like, we're here for you. And what are we doing? We commend you for this. And like, heck yeah, you're here and you're strength training. So good job. Like,
exactly. I wish women felt better about talking about it, because some of the things that they're probably experiencing, the next person next to them, sitting next to them is probably experiencing the same thing. They're wondering it, like this, about whatever it is nutrition wise, or did this bother you? Or like, what are some good protein sources that sound good, that you're able to, so if we like bring it open and say, yeah, I'm taking treatment for the inflammation in my body, for my cholesterol, for my blood pressure, for my heart disease risk. And yeah, a lot of the fat that is lost is visceral fat. It's bad inflammatory fat. That's not a bad thing, If it's not like you're going and sucking it out of there, you're truly changing, how good your body is responding to things. And so just being more uplifting and, helping support each other, I think, because and I do think that in the community space of Victress where you're at, it is not all about that, they're doing it in a very safe way, in a responsible way, that they're treating underlying indicated conditions versus just a number on the scale or a picture in the mirror,
Yeah. Well, in closing, I was going to use myself as an example here. Like my last labs were not great, right? They were not the best that we've seen. That's for sure.
What's up here?
We got some stuff going on.
Yeah.
But I would say my nutrition on a scale of 1 to 10 is probably a solid 6 day to day. I have good days and bad days, but it hasn't been, I live a crazy life, and it's more the quantity of food that I'm consuming versus not, that's an issue. But, on the outside, I look extremely healthy. I live in a little bit smaller body. I can put on muscle mass fairly easily. Luckily, like that's something that I think I've earned the right of over lots and lots of years of strength training. But you're talking about all these benefits, and like, I'm thinking to myself, like, I would probably benefit from something like this, right? From an internal perspective. But then I'm also not in a position that I'm really looking to lose any weight. Like that is not something I want to do, right? So what are we doing with people like me, or people that are obviously I have to go to default to lifestyle, right?
Yeah. And I think, we'll be seeing so much on the horizon. Like you can really get a good like probiotic, GLP-1 promoter probiotic and working in our gut. And I think that that's a key for women in inflammation, which is even a newer realm for me to practice in. But I see it so often, the issues, and then we correct that, we get that better. Metabolism improves, sleep improves, your habits improve, your energy improves, because you're actually absorbing and using these great nutrients that are in all of our blueberries and our rainbow of vegetables and all the B vitamins and the ferritin and stuff. So I had this question. I did a talk at Fleet Feet 2 weeks ago about inflammation, and this avid, like super healthy runner, she looked great, muscular. She's like, I think what you're saying is I should take these drugs. And I was like, that is a question. Like, how beneficial are they? And I think the long term will tell how do they, if they do, reduce risk of dementia, vascular diseases? So tailoring to a family history, because we put people on statin medicine when their LDL is normal at 100 because of their family history or their risk factors, right? So, but again, it goes back to like inflammation for me too. If I start to see changes in a person's system based on what they tell me or what their lab is, then that's going to be a conversation about what should we do about it. And, it's it's probably not always going to be a GLP-1, but there are times when we've got to reset something. And some people are not taking these forever. Some people are taking them for a short treatment period and taking them at different doses and maybe not weekly. And we're still seeing the benefits of it, So I think there's so much more on the horizon with that. I think the next one is supposed to spare muscle mass. I don't know how that's going to happen. But if somebody can tell me how the first ones work, then that would be great. I'd probably understand that. But I think, there's so many ways that, we can see what happens with this, but work in different ways too, that we can get good results without them.
Well, and I think accessibility is just going to increase, right? Pending nothing huge and catastrophic comes out as far as risks.
Yes.
I've heard a little bit on like potentially like if you're wanting to get pregnant anytime soon, like maybe that's probably not the best idea, like coming off early enough for that, like that type of stuff. But pending we don't see anything like extremely catastrophic coming out of these medications, like the accessibility is just going to increase, I would imagine. Yes. Like, it could be a pill here very quickly, probably. Yep. Versus injections and stuff. Yes. So yeah, I think
I'm like, if you could take it in something once a week and it's going to work, I'm like, that works into our busy lives way better than taking something every day,
I swear I take like 8 supplements.
You're like, I might not need all these, but maybe it sounds good. TikTok told me this would be good for me. Yeah.
No, Mary Jane says this is what I'm supposed to do.
Yes, I know. One of them, one supplement is 4 capsules, so it's really hard to take.
Yes, I'm like, okay, 1, 2, 3, 4. Okay,
there you go.
There's one. No, it's exciting. It's I think it's a hot topic out there. Obviously, like we said, I think that I'd love to get Stassi on too, and maybe a couple others that have experienced it for themselves, speaking on it, from a fitness professional and from a medical professional perspective. I think that maybe we're saying things a little bit different than the hate and the negativity out there, but each having our own little concerns on things and being able to speak to it in a responsible way, hopefully. Somebody like me, I'm not going to be able to just like walk in there and be like, hey, Mary Jane, like, this is what I need for myself. Probably not.
No. We've had people try that. I've had people try that. I'm like, no, not happening. Sorry. That's not how it goes.
No. And why? Like, what are we looking for, in that scenario? But like you said, from a health perspective, I had higher cholesterol. I had some inflammation markers, like all of those things, like it makes it sound pretty appealing in a lot of ways. So, working with a provider that can help you, work on those things, whether you're taking the medication or you're not taking the medication, it still needs to happen. Its changes still need to be made. So,
yes.
Well, thank you very much. I know I'm going to have you on because we have perimenopause, we have menopause, we have menstrual cycle, we have, breast cancer. October, I definitely want to do. I want to do a big one in October on several things with that. So, but I appreciate your time today. I know you're a busy lady, so thank you very much for coming on and having this conversation with me.
Thank you for having me and for what you guys do for the community of women, and being a safe space is a huge greatness that we have here and now in multiple more areas. So exciting.
Well, and I know you're hard to get into. So let's preface it with that. She is a very busy lady, but she's putting processes in place and all of those things to make sure that she can see as many of us women as she possibly can, as quickly as possible anyway. And I think it's powerful. It speaks to what you're doing in regards to women being heard and being seen and feeling valued, and debunking a lot of different things. So keep it up.
Thank you.
It's needed. It's nice to know that in Lincoln, that we have these types of resources. So yes. All right. Well, we will chat soon, girl. Thank you.
Right. Thanks, Nancy. Bye.